Hello everyone, my name is Humphrey, and on my left is Sandra, and on my right is Whitney. This is Team 39, and we are addressing COVID-19 vaccine hesitancy in Nigeria. Looking at Nigeria as a country, the total population is 206 million people. As in 2020, 49.9% of these are Christians and 51.1% are Muslims. 40% of the Nigerians live below the poverty line, and 2.9 million people are internally displaced in the country. 306,000 Nigerians are refugees in other countries in West Africa. Nigeria's COVID-19 situation, we have a total number of 161,261 cases, and out of these ones, 146,395 have recovered, and then we have a total of 2,027 deaths. COVID-19 in Nigeria vaccination commenced on the 2nd of March 2021, and in the country we are using AstraZeneca as the vaccine. Looking at the previous vaccination trends in the Nigeria right away from 1990, we are looking at a total decline of we are looking at a total decline in vaccination rate from 80 to around 10%, and then we see a slow increase in the vaccination rate. Some of the factors that have caused that include lack of awareness, service delivery, lack of time or other family issues, and mistrust of the vaccine and the sources of the vaccine. Other factors include the low number of health workers. For example, in the northern part of the country, we are seeing the low number of health workers doing vaccination. That means most of the people do not receive the health services. Our team aims at creating awareness on COVID-19 vaccination, also engage and increase and sustain community participation in the vaccination program, and increase access to COVID-19 vaccination services.
This is our one-year phased approach. We divided our year into 4 quarters. In the first quarter, we are aiming at creating awareness. In the second quarter, we are aiming at community engagement. And in the third and the fourth quarter, we are strengthening our program and following up. We are aiming at creating awareness through the educate and inform strategy, where we are going to carry out community campaigns like culture festivals, where we are going to use these culture festivals to reach out our information. We are doing radio and TV campaigns, where we are airing out information about the benefits of COVID-19 vaccine. We are carrying out trainings of health workers and community leaders to equip them with knowledge so that they can reach out to their communities and teach them about the benefits of COVID-19 vaccine. We created an advert about the COVID-19 vaccine, where Mr. Ozo was having questions about the safety of the vaccine, but while he was watching the TV, he saw this advert with the COVID-19 helpline, and he contacted the helpline and he was answered immediately. He told his friend about the helpline, and the friend also contacted the website. So you can always text your questions. I will visit our website and get your answers.
In order to ensure community engagement, participation, and ownership, we intend to do coalition campaigns, and these will involve the traditional leaders and the religious leaders to engage themselves in the whole process of this vaccination. We also intend to do community engagement meetings, where we will engage the community members in the decision making of where to put the vaccination centers and the whole process of vaccination. We also intend to involve the men, since they are seen as the decision makers in Nigeria. So if we involve the males, that means we can be able to influence the whole population to vaccinate. In order to bring the services nearer to people, we intend to put up emergency vaccination centers in each of the 19 states in northern Nigeria, and also carry out mobile outreaches for vaccination in hard-to-reach areas. The vaccines will be distributed at federal medical stores and from there they will be transported by a helicopter ambulance to the state medical stores, and then we will use the cars that we will have hired to transport these vaccines to the vaccination centers that we will have put in place, and also the existing ones. And from there we can use the cars and also vaccine carriers to bring these vaccines to the community where we will be doing the vaccination from. Nigeria is using AstraZeneca vaccine, and we all know that it works well within a range of +2 to +8 degrees Celsius. And in order to maintain its safety, we need to ensure cold chain throughout the whole process of vaccination. How we'll ensure this is by using solar-powered fridges to maintain that temperature. And also, as we carry the vaccines in the vaccine carriers, we will put ice packs that can maintain the cold chain throughout the whole process of vaccination.
And this is how we shall implement our program. In the first quarter, we shall do community awareness majorly, involve doing adverts to the community members, making them aware of the program. And then in the second quarter, we shall do community engagement, involving community members in running activities of the program. For example, in establishing the vaccination points, in extending vaccination to the hard-to-reach areas. And then in the third quarter and the last quarter, we shall majorly do strengthening and engaging and increasing accessibility, and then following up, especially for those ones that are in hard-to-reach areas of the country. Yeah, our budget, how much we shall spend and how we shall spend it will actually go in hand with how we shall do the implementation. For example, in the first quarter of the year, we shall spend most of our money there, around 50% of the budget, because that's where we have most of the activities. And then in the second quarter of the year, we shall spend 20%, and in the third quarter, 15%, and then in the last quarter, 15%. That is how money will be spent according to the details as per budget, as per our budget.
We are going to monitor and evaluate our program while we are addressing vaccine hesitancy in northern Nigeria. We are going to monitor for awareness of this vaccination program in the population, where we are going to find out the proportion of the population that is aware of these campaigns, and that is how we shall measure the level of awareness. And we shall also monitor for the engagement of the population in the vaccination program. Here we shall find out the number of meetings that we have held with the community members and the strategies discussed in the meetings that we have actually implemented. For service delivery, we are going to find out the communities that we have reached, where we shall find out the number of communities that we have reached with our program and the number of people in those communities that have been vaccinated. We are going to work with these stakeholders while we are doing the vaccination program, and we anticipate risks while we are carrying out our program. For example, we anticipate technical difficulties involving our transportation, but we shall have helicopter pilots to deal with the helicopters and ambulance drivers to deal with the ambulances that we shall have hired. For vaccine misuse, we are going to have supervisors in the communities who are going to do supervision to ensure that vaccines are handled well and they are not misused. We are going to carry out health education meetings to ensure that we combat the misconceptions amongst the population, and we are going to do training of health workers and community leaders to equip them with knowledge so that they can move out to people and tell them about the benefits of the COVID-19 vaccine, and people can have trust in the vaccine. Thank you very much.